Hello, everyone. Thank you for joining me today. I am Dr. Nelva Bryant from When Pets Fly. This is the Veterinary Air Travel Podcast, and I'm here with my special guest. Actually, it's the second time he's been here with us. His name is Dr. Boaz, and he's very, very prominent in what he's doing in the veterinary profession, very, very detailed as far as the procedures he's doing. But before I get into that and have him introduce himself, let me introduce myself. I'm Dr. Nelva Bryant. I'm a veterinarian, and I work in the airline industry. I am on staff with Delta Airlines and have been so since around 2018 and have learned a whole lot about animal transportation in general, but I do focus on pets through my brand When Pets Fly because I saw that there's a lot that veterinarians and pet owners do not know or realize about protecting their pet during air transport. So I share, in a sense, pet-centric travel education for veterinarians and pet owners, and hopefully again, to get them better prepared for air travel. So that's what I've been doing for these past few years. I do have a social media presence. I'm on Facebook, Instagram, and LinkedIn. I also have a YouTube page. I also have a website. And if you want to learn some information I've been sharing, please go there. It's www.winpets.com. I provide consults if you want, as far as pet travel. If you need to, say, get some research done from one source that kind of knows everything as far as international travel with pets, you can apply for a consult there, and I'll help you out whenever I can. So I'm willing to do that. But also what I've been doing these past few years are these podcasts, which I love because it allows me to introduce everyone to different, as I always say, different stakeholders in the animal transportation industry. I have a lot of repeat guests. I have new people coming on. I have pet shippers, folks talking about service animals, nutrition because nutrition is part of pet travel as well. And today I have Dr. Boaz, who's actually been with us last year, I believe, but unfortunately I wasn't able to kind of have a rapport with him because I had computer issues. So this is going to be our first time together, really, really hashing it out, talking about Boaz, and we can just explain that a little bit further in a second. But please, Boaz, Dr. Please go ahead and introduce yourself.
Hi, Dr. Nelva. Thank you so much for having me on the show today. And one of the reasons I love to connect with you is because you're an animal welfare vet, right? And you want to make sure these pets are traveling safely. And the oath we all have as veterinarians is to make sure that no animal ever suffers, right? So, we share that common goal. And my name again is Dr. Boaz. I'm here in Boca Raton, Florida. I am the medical director and the owner of my own small private practice here in Boca Raton called Boca Midtown Animal Hospital. And I'm very proud that we do our best every day to help pets who suffer. We are accredited. We're a fear-free accredited hospital, which means we take not only the medical wellness of every pet very seriously, but also their emotional well-being. We also are accredited by the American Animal Hospital Association. So we do everything we can to make sure that we stay up to date on compassionate care, yet staying up to date with the current standards of things like pain management and surgical care. And my special interest is helping these short-nosed dogs who are suffering. These dogs are America's most popular dog breeds, and actually, as you know, internationally, the most popular dogs in the entire world. They're beautiful dogs, they're companion dogs, they're intelligent, and they have their own health risks. And I know that's why you asked me to come join you to talk about those things today and to talk about BOAS, which is simply these dogs live with airway obstruction. So there's essentially too much stuff in too small of a space. So we're talking about their nose and their throat. Yeah, so they have these parts that are really prohibiting them from living their best lives.
Definitely. It's so interesting about the syndrome itself. Because of their short snout, being brachycephalic and their short snout, all those regular structures that would be present in a normal dog with a normal snout are compressed. And that's the major issue behind them. And folks they probably think it's cute. Oh, my dog snores, all these little things little quirky things they do. But actually, sometimes it can become a medical issue for them, and especially during air travel. But please, I want to go in more as far as what you do, and we can always talk about air travel and my thoughts on that. But I definitely want to bring out a lot of things that you're doing because it's really important what you're doing to help these breeds.
Sure, absolutely. I kind of happen to be in the right place at the right time with the right name, right? So my name is Boaz, B-O-A-Z, and this problem, has changed over time. We used to call it brachycephalic syndrome or airway syndrome, and then it actually became more obvious as to what it is. It's called BOAS, for brachycephalic obstructive airway syndrome. So I happened to put a video up of a French bulldog who couldn't breathe. He was, with his mouth open because he couldn't breathe through his nose, and then had the surgery and then was breathing happily with his mouth closed. And that one video that I posted quite a few years ago, it got a lot of attention, and it started a very important conversation about this problem. And exactly what you said, we got to get away from these normal, oh, it's normal that my dog snores, or it's cute, it sounds like a pig, or it's normal that, he hacks up, or it's normal that he can't walk outside. It's normal that he has to live inside in the air conditioning. It's normal that he has to, eat from our elevated bowl. It's no, all the things, et cetera, et cetera, et cetera. These are not normal things. And the basics is keep it simple. If it doesn't sound normal, it's not normal, right? And recognize that and ask questions. And if you're asking questions from your vet and it's going under the rug, then maybe ask them for a referral just for another opinion. Hey, it's kind of bothering me. It's bothering my dog. My dog's not able to do the things that other dogs do. So what can I do? And that's what we're here to talk about. And there are, thankfully, things that have improved over the last few years. We've learned more about BOAS being an airway obstruction. We're not reactive, we're proactive, right? We're finding the problem early, recognizing it early, and then we're really making a difference. Whether we're not doing that wait and see method because that was doomed from the start. Oh, let's wait. We see there's an issue, but it's not that bad. Let's wait till it gets a lot worse and then try to tackle it. That's not a good answer for any problem, right?
Yeah. Let's get away from being, let's be proactive, not reactive to everything. And that's what you're saying. It's perfect. Just like I said, if you recognize an issue with it, even though it might be common in the breed, it doesn't mean it's normal. And let's get around that and everything. And if your veterinarian keeps saying, oh yeah, it's normal, it's no big deal. Yeah, as you're saying, maybe find another veterinarian that can assist you better with this process. And it's unfortunate too with a lot of these, since they're a popular breed, and I'm going to say French Bulldogs, very popular breed. Because of that, there's a lot of sometimes breeding, backyard breeders and everything, and maybe the quality of them are not as good as others, and they might have more of the clinical signs of BOAS than others. And go, if you can, give us the clinical signs of BOAS.
So if your dog has to breathe with its mouth open, right, that's a problem because they're not able to get enough air. They can't breathe well enough through their nose. If your dog's making that noise, that stertor, that's an obvious airway obstruction. That's usually a combination of the upper airway, the nose, and the throat, just having a real problem getting air. Try to pinch your nose like that, right? I always tell the pet parents, you try to breathe like that for like 2 to 3 minutes, and then tell me if you think it's a problem for you or you prefer to have a nose that actually is a functional nose.
Right.
So that's obvious. Not being able to go for a walk outside, they can't really release their body heat because dogs need to be able to pant. When they are restricted and they can't ventilate, right? They can't get air through their nose or their throat, they get too hot. Then they end up at the ER because their temperature goes over 103. These dogs start to shut down, and quickly they can, have serious life-threatening problems. And it's not a joke. It's not funny. It's not cute. And we got to start really having obvious conversations. Your dog is showing signs that he has difficulty breathing. He has an airway obstruction that's active. It's not something that just goes away on its own. It's not going to improve with time. Hacking, choking, snoring, gagging, regurgitation often is part, especially in the most common dog, the French Bulldog. Regurgitation is really high on the list. Why? Because they got too much stuff in their throat. They got this flap in their throat that's called the palate. That flap just sits there and basically blocks the entrance. So they got the epiglottis on the bottom right here, and then they got this flap, and this flap keeps trapping. Every time they try to breathe, that epiglottis gets trapped onto that soft palate. So imagine trying to breathe through that wall. It just doesn't happen. Right. So when they get lucky, they get like a tiny little, I would say like a little tiny hole where they can get air through. So when we get x-rays of these dogs, we can see that tiny little airway in the throat looks like a straw. That's why you probably hear, oh, he breathes through a straw. So it's a real significant animal welfare issue. And the problem's only getting worse, like you said, about the bad breathing. The reason these pet parents are so attractive, and all of us as human beings, to these dogs is because they're beautiful. They have these big, wide faces, these big eyes, these cute little ears. And there's been some studies that actually have proven that they remind us, especially when they're young with these big round faces, of newborn babies. So there's that instant human animal connection with these dogs that are so cute. They're not too big, where we can keep them in smaller areas, in condos and things like that.
Yeah.
Right. So they're, people say, oh, this is so cute. They get a dog and then they don't have the research, or they don't have the expectations or the potential health risks. And they're not prepped. And that falls on us. We're veterinarians, and we have to educate these pet parents on the potential health risks. And unfortunately, we made some jokes about it in the past, and vets have come a long way. We've had hundreds of studies now that have shown, these problems and the health risks, especially with the airway problems over the last 5 to 10 years, hundreds of studies showing, what we can do and how we can recognize it, and the outcomes for these dogs when they have early corrective airway surgery. And now there is a recent study that just came out that's showing that the laser surgery is one of the best tools that we can correct these highly vascular areas. So they're very, well supplied with blood in the throat and in the nose, and remove those areas. Those are soft tissue with minimal complications. And that's really what we want. So we don't have sutures in there. That those procedures help us to remove those parts with less bleeding, because it seals blood vessels, less pain because it seals nerve endings, and less swelling because it seals lymphatics. So people are finding out about the laser surgery more and more. I am very proud to have helped improve the technique, not only to discover new ways to improve the technique, but also to teach veterinarians who are interested about it. I've done quite a few webinars. We do our laser surgery meetings every year. So my goal is to leave this profession in a better place than when I came into it, and really helping these dogs who suffer so needlessly. So I'm really very honored to be part of this movement, and I think veterinarians are always looking for new things and new ways to help pets. And we still have the best job in the world, because we get to cuddle with these dogs, we get to make them better, and there's really nothing like seeing these dogs go from really struggling to get air to just loving their lives again.
That's perfect. That's perfect. Hey, you mentioned studies and everything. I'm going to pull into a little things that I do know about as far as pet travel with them. There's no major studies as far as with the breed, as far as being transported, but the Department of Transportation, they do have information that was gathered years ago, just noting that the incidence of deaths during pets being transported by cargo were increased with these brachycephalic breeds. And I'm sorry, let me explain for everyone else. The Department of Transportation, airlines that have 60 seats or more and travel pets by cargo must report any animal incident to the Department of Transportation on a monthly and a yearly basis. Monthly is more if there's an animal incident, and that's going to be if there's a injury, escape, or death. And then, so they have to report that on a monthly basis. And then yearly, the number of pets that they transport going by cargo. So this is from that data, capturing that data, they were able to see that the number of deaths were more increased in dogs that were brachycephalic. So that's why pets going by cargo, most airlines will restrict certain breeds because of that. So folks have to realize there's a safety, animal welfare risk behind transporting a brachycephalic breed going by cargo. So if your airline restricts it, do not find ways to move around that. That is to protect your pet. And it may not be convenient for you to not have them being transported by cargo, but it's a safety feature on there that the airlines abide by to ensure the safety of your pet during transport. So, but again, the studies have shown they don't do well with cargo. That's why they're restricted. And it's because of this syndrome. And again, this was before, I guess they didn't have any scientific basis behind it to say why. They just put it on certain breeds that they noticed that it was more common in. But we know that it's because, as you said, elongated soft palate, stenotic nares, What else am I missing? They've got sometimes they have the trachea is even stenotic, isn't it? Or is it more narrow?
Yes,
Yeah,
hypoplastic
yeah,
trachea. Yeah, their
yeah,
windpipes are basically just, smaller than other dog breeds and
yeah,
not as sturdy, right?
yeah.
With time, this event, this BOAS
Hmm.
will create problems and complications that arise, like inverted laryngeal saccules
Yeah.
and laryngeal collapse. Basically the saccules is the first stage of that laryngeal collapse. Basically, imagine having like a little handheld vacuum attached to your mouth, right? And every time you're breathing, it's creating a lot of what's called pressure and negative
Hmm.
airway pressure. So it's almost like a tug of war with their breathing and their stomachs. So it's creating all this kind of friction inside, and it's irritating to their throat, their esophagus. They get esophagitis. It's irritating
Hmm.
to their stomachs because they're having like their esophagus basically being pulled up by their pressure, like that vacuum that's created in there, and they get reflux. They often unfortunately get aspiration pneumonia,
Hmm.
or they have something that's aspirated that gets stuck there, and they have this flap that basically doesn't let anything in or out, and everything kind of is a bit of a ticking time bomb where things swell because they get anxious, right? And when
Yeah.
they're on a cargo plane, they get anxious and things
Yeah.
swell. They can't be like other dogs and just calm themselves down. So they go
No.
into this crisis. And then you hear about these dogs, even the Frenchies that have been on airplanes, that just get so anxious they can't calm
Yeah.
down. And then they end up with an obstruction. And then, the worst case scenario happens.
Well,
So, yeah, that
obviously
can happen.
with it though too. I mean, all the things you're saying there too. But another side note that happens along with it is that a common way that dogs relieve when they relieve their temperature when they get overheated is through panting. They can't
Right.
properly pant and dissipate this heat from their body, so they overheat. So a common thing that can happen, besides the respiratory issues and the aspiration pneumonia potentially can happen there, they also can have heat stroke and lead to death based upon that. So
Yeah,
that situation, yeah,
thermoregulation relies on
yeah,
adequate ventilation, right? And
yeah,
how can they ventilate when they got nothing going on up there?
right, right. So folks have to understand that. And the interesting thing is, it's maybe say within the past 2 years, there were incidents where some French bulldogs were in cabin and they died, and they were like, "Oh my goodness, they didn't know what's going on." But if you they get so stressed with everything that's going on with them, it can happen in cabin or going by cargo. But folks are thinking, "Oh, if it's in cabin, they're safe." No, this whole environment, this whole event of traveling by air brings a level of stress on them. And there you go. And you got a perfect storm, I guess you could say. They've got all these things going on. And now you added air travel to the mix. What do you think is going to happen?
Well, Nelva, you hit it right on the head. It's all about anything. And I'm saying anything. They might not like their dog, their neighbor's dog. They might not like that stranger walking into their house, the mailman. You name it. It's all a source of fear, anxiety, and stress. And
Mm-hmm.
those three things in combination, anywhere, anytime, they can strike. And when that happens, sometimes it's when they go to the vet, and then the
Mm-hmm.
vet's dealing with this respiratory issue in the middle of like my practice, when we have a lot of different things that we have to manage on a daily basis, and then we have to interrupt everything because we might have a crisis on our hands.
Mm-hmm.
We got to get the oxygen out, we got to get them appropriate medications to calm them down.
Mm-hmm.
And so this has been a problem for a lot of people. The pet parents are afraid to bring their dogs into the vet because the dog gets anxious, right? The vet's afraid to deal with the problem sometimes because they're busy and they don't want to see a dog that's suffering and anxious. So, sometimes things unfortunately get missed, or these people that bring their Frenchies on the plane. My vet said my dog never had a problem, and all of a
Mm-hmm.
sudden, they're suing the airlines.
Yeah.
These dogs are unfortunately, born with certain problems that get worse with time,
Mm-hmm.
and it's our time to address it really early on, because we failed as veterinarians if we haven't at least had the conversation. Hey, it might not be my thing to do the BOAS surgery, but what I see on the physical exam is not normal. So one thing we have to do is say, this is normal or this is abnormal. And we got to stop saying, oh, it's breed related, because that's like the escape, and that's not acceptable. It's not.
Yeah. Yeah. Definite. My question for you is, if a person comes to you, and I don't know if you do many travel cases, but what are your thoughts on as far as signing health certificates saying a dog that has BOAS and signing a health certificate for them to travel? I mean, everyone always thinks health certificates mean that they're healthy, or it's more of meeting the requirements of that destination as far as rabies vaccination requirements or other destination requirements. It doesn't really assess the health of that pet. So if someone came to you, what are your thoughts, or a veterinarian, what are your additional thoughts you think they should do in assessing a dog that's going to be traveling by air?
So as a veterinarian, if you have a dog that comes in, right, and it's making noise, and the pet parent maybe was told by the breeder or somebody else that it's normal, but you've actually recognized that with them and had the discussion about the problems that they have breathing, it's important to have that addressed before they go into a situation that's stressful.
Yeah.
And before they become at risk to have an obstruction, whether it's on an airplane or in a car or whatever the problem is. And it's also important to make sure that we control their anxiety, right? And that we recognize their body language telling us what creates fear, anxiety, and stress. Mm-hmm. Find out what the triggers of those things are. That's why also it's so important to recognize body language. And as veterinarians, we've done that for a long time. And it's a big part of just why I'm passionate also about providing fear-free veterinary care, because mm-hmm. if we can recognize, hey, the body language in your dog is telling me he's anxious, and because you have a short-nosed dog, the more anxious that dog gets, the more potentially that dog is going to start to have a hard time breathing. So that should be priority number one. Make sure that we recognize it and address it and keep the anxiety levels down, and get those health certificates are signed. We're signing that those pets are safe to travel. Really, that is our kind of our reputation, our license. Mm-hmm. It's hard. It's a difficult thing, because the pet parent wants to travel with their pet, but at the same time, there's a risk for that situation. So I would say always try to mitigate your risks. There is a little thing called a B risk score. A B risk score is brachycephalic risk, and it's a little study that was done on the short-nosed dogs, and it actually gives you a number, and it tells you how high is the risk for your dog, whether it's for the BOAS surgery, that's what it was designed for, or for any other problem. So you can get a number with that score basically by clicking if your dog is a Frenchie, if it's had airway surgery before, if it's always making that noise, or if it's quiet down, that sturder, if their body condition is excessive, if they've had the airway surgery before, what their temperature is, all those things that kind of factor into the number at the end. And if that dog is a number over 3, the B risk score, you can go to Wiley to check that out on Google. Mm-hmm. Then that's an indication that you should probably address that right away and not wait before you travel to have it addressed. Right. So those are easy things you can do. Obviously, knowing your dog, your dog better than anybody else, and recognizing when they're struggling. The red flags of these problems are so important.
Yeah, I love that. I didn't realize they had a scoring for that, and that's really good to know. Really, really good to know. But as I mentioned earlier, there was the situation in the news. I think the pet owner had 2 French bulldogs, and one of them had the issues during transport and the other one didn't. But again, ultimately, I think they had said that they had described the airline as not pet friendly or something. They were blaming the airline for it. I'm like, well, how the airline is responsible when one dog had it and then the other one was fine? It had to be something inherent within that one dog in reference to what was going on. And everything. I guess I say this all to say, as far as traveling, again, as you mentioned, any stressful event and air travel, new people, going to a new environment, even traveling by car to somewhere new, anything can stress them out that bad where they can succumb to BOAS, basically.
Absolutely.
Wow. Folks, pet owners really need to understand that, really, if you have those breeds, and I have one, and I'll be honest with you, he was given to me and I haven't addressed, he's I say he's fairly fine as a veterinarian. It's terrible. I'm a veterinarian. I should do better, but I think he's fine. He's the only breed French bulldog that I've ever seen that has a normal bite, no underbite. He's perfect bite. I'm blown away. He snores, yes, but it's not as bad, but I'll admit I need to do better. I need to learn his score as well.
Yeah, I mean, the more information, the better, and just trying to keep it as simple as possible. I would just say, understand if your dog, would live a better life if they could breathe better. The answer is usually yes. The dog will have a better life if they can breathe better, because these dogs suffer from, fatigue because they just don't get enough oxygen, right? I would say this, like, if you ever had a child, I have 3 kids, and they can't sleep at night, they have an adenoid problem. Just the other day, my wife was at the pediatrician, and the pediatrician was like, I give him a lot of credit. He said, make sure that your son doesn't sleep with his mouth open, because that can result in a lot of problems, over time. These children and people suffer from sleep apnea, and there's no difference with these dogs. They get worse with time. They have a hard time sleeping because that flap is basically just blocking their airway. We have a lot of these dogs that end up learning to have a toy in their mouth to sleep,
yes,
keeping their mouth open. All these things, they're just chronic, stress on not only their breathing, but their heart, and their liver requires oxygen, and all these things just compound over time. And, just oxygen is not a joke. You need it, and these dogs need it. So it is our job, to make sure we recognize it and make sure that they get addressed, earlier than later, because these dogs, once they go to that collapse of the larynx, that's not reversible. So, some of those dogs end up having to have a hole put in their throat because they have to bypass everything up here so they can get straight into that area. Yeah, they have to live with a hole in their throat if they have laryngeal collapse.
Like a tracheotomy, a little.
Yeah.
Wow, to that level.
And there's complications with that. The hole in their throat, gets infected, closes up, can't go swimming, obviously. Lots of problems that are not good for anyone. And BOAS is a progressive condition, and pet parents need to know that not every dog is the same. We do our best to help to give them a better life for as long as possible. But it is something it's a big problem, and the popularity is not going away. These dogs, continue to rise in popularity, and, top 3 are Frenchies, English Bulldogs, and Pugs. Those are the top 3. You can see there's a couple of them right behind me. But they're intelligent, they're good companions. I don't see them just being banished. They're not going to go away, and it's our job to make sure we address those things.
Question for you: what about cats? Like, breaking about cat breeds. Do you see them much? What is it? Persian? Gosh, I should have this name off the top of my list. There's at least 6 of them that I know that are restricted breeds for going by cargo. I believe Persian is one. Gosh, help me out here. I'm going to blank on them. But do you deal with many of cat breeds, or as far as them coming into your hospital requiring this procedures?
So that's a good question. On occasion, I will hear about it. I can't say that I have enough experience addressing the cats with the flat faces. There are some things that can be done, but because their noses are so small and delicate, it's a bit more of a challenge to help them with their airway issues. But certainly, I would say that I would probably be the wrong person to answer that question, just have not had enough experience with cats and having any airway correction. So I would say definitely do your research, make sure, if you have a cat like that you find someone who has experience with that problem.
Yeah. Well, it's unfortunate. It seems as though in veterinary medicine in general, dogs always get more of the attention than cats do, it seems like, unfortunately. But if anyone, as Dr. Boaz said, if you have a cat that has an issue with it, just try to find a specialist. And I'm sure they could probably reach out. I'm sure you might have colleagues that potentially could assist in that process.
Absolutely.
Yeah. Oh, man. So tell me, what's the ideal candidate for you as far as doing your procedures that you usually do surgeries? What's your ideal candidate?
So the candidates that we have more success with in general are, candidates that are younger, right? The average age should be somewhere between 6 months and 2 years. Now that's not like a black and white rule, I should say. We see dogs that are 4 years old, 3 years old, 5, 6, and older that have had improvement and have success with the BOAS laser surgery. But I would say in general, the younger dogs have a better chance of doing better for longer because they haven't been living with that vacuum system, right? They haven't been living with that chronic airway pressure. And, there's a chance for them to breathe better for longer than when they get older and they potentially been suffering with for longer and they have already developed some laryngeal collapse, or they develop some other comorbidities, some other sicknesses that are related, to other problems. So in general, we screen every dog that comes into us. We want to make sure that they're good candidates because we really want to make sure they have, a appropriate recovery, a good successful outcome. And we do that by staging them with a number of different things. We start with that B-risk score to give us kind of a number, but then we make sure we do our complete physical exams like every vet is doing. We do their appropriate testing. We do things like evaluating their internal organs, blood work, and we do x-rays so we can see not only their lungs and their heart, but also their upper airways very well. And we have amazing veterinary radiologists that help us really with interpretation of all these different parts. And, it basically, we want to know what we're getting into before we have them under anesthesia, right? We want to know, what kind of potentially some of these dogs come into us and they're living with aspiration pneumonia because the pet parent thought it was normal for them to breathe the way they do or to make the noise the way they do. But then we got x-rays and we see that there's a pneumonia in one of the lungs. So, it's so important to do your research on making sure that, your vet is familiar with the problem, can appropriately, screen them, and if not, and correct them with, the right, with the right team versus, having them send you somewhere where, they have a team that can do that. And one of the reasons that, people have come to practices like mine that have experienced laser surgeons is because it's often a outpatient procedure where they can come in the morning, they go home in the afternoon. They don't have to be hospitalized with intensive care or critical care. There's no sutures there. There's no cone of shame. They can, have a minimally invasive procedure and have a better ability to breathe. And I'm not saying every dog is that way, but I would say a majority of them, I would say 90 to 95% of these dogs do great. They don't need additional care, and they don't require, nursing care and, ER care. And so that's a big change that's happened because of, our ability to remove those parts without, creating too much of a problem in other areas. And without having to worry about complications because they don't have to worry about the surgery sites opening up because there's no sutures in there. They don't have to worry about, the pawing on the nose because there's no suture in there. Basically, we're learning to do things better. And thankfully, technology has come a long way, like with everything else, specifically with laser surgery. I've been a laser surgeon now for over 20 years. And, these kind of procedures were, scary for pet parents and for vets in the past for those reasons that we just discussed. But now, we're seeing a lot of a game change and a life change in a procedure that can be performed in 30 minutes, 60 minutes, and it's a great option for these pets.
So definitely, you're saying same day procedure. They go home at the end of the day, and as far as recovery, when do you think, as far as eating normally and everything, how long does it take for them to recover?
So normally they do well when they're appropriately screened with the appropriate candidates. They're young. They should start eating, within 24 hours of the procedure normally. As far as the stomach issues, it is pretty linked to their airway issues. So we've learned they're called aerogastric disorders, right? So these parts, also one of the benefits, I should say, specifically for the Frenchies is, they either improve with their regurgitation events because they get excited. They see someone and then they get this phlegm in the back of their throat, then they have this flap, and their instinct is to hack it up. I mean, imagine living, everyone's had an experience where like, oops, they swallowed something the wrong way. And it's like your life basically flashes in front of you and you're like, oh my God, I'm going to die. Imagine living like with an airway obstruction all your life. It's sad. And it's something that, I'm so thankful that we're helping so many dogs. It's so rewarding, for these pets to breathe. We see the look in their eyes, their first real breath with 100% oxygen. We see the pet parents look at them like, even after the surgery, we go outside for the walk here and they're like, my dog could have never done this before. He would already been that open mouth breathing, and they're just like looking in amazement at their dog with their mouths closed. It's just such a nice thing to be able to do. And, when we as veterinarians, do the same thing over and over, and it gets kind of routine and mundane and you get, kind of fatigued. This is one of the things that really reinvigorated my passion for helping pets that suffer, because, there's not a lot like this that we can do in general practice to make such a big difference, for the long term. So it's really rewarding.
You get an immediate reaction because you think about all the other procedures that's fairly routine. I mean, spaying and neutering, what do you see as far as, immediate recovery or reaction from that? Here, their breathing, everything is impacted. And so you see the immediate reward, which is awesome. Very, very nice.
It's really just part of an amazing thing, and it never gets old. And, we're just so grateful to help these dogs because they really need help.
Yeah. I remember before I met you, I remember catching some of your videos, and at the time, I don't think I was listening to the volume, and I just saw the photos and before and after. And I was like, wow, he's doing nasal reconstruction, but I'm like, but it's for a purpose. I mean, they may look a little bit different as far as their nostrils, but it's beneficial because all that extra tissue that wasn't necessary, that's impacting their breathing through their nostrils, it's gone now. So nose might look a little bit different, but hey, it's okay. You can breathe better, right?
Right. And that's an important thing you hit on, that nose. Yeah. So when the pet parents look at the nose and they see the outside, the opening, I would say just understand that's about 20 to maybe 30% of the problem. Like, oh, the nose opening doesn't look too bad. I don't think my dog needs the nose done. Well, the surgery itself is called an ala vestibuloplasty. And when that's done with a laser, right, we can actually go in there and make those cuts. And the problem is when you go in there and in the past just tried to widen the opening and just take a little wedge out the front, it didn't really do much, right? It just made the opening looked a little bit bigger. But just imagine this, right? You got a pipe that's clogged, right? There's a clog in your pipe. So would the solution to that clog in your pipe let's make the opening to that pipe just a little bit wider? No. Is that going to remove that clog? No. So we got to get the part inside the nose, which if you look on our Instagram or any of our social media content, we pull it out. I kind of call it like the magic trick. It looks like this huge booger basically, and it's red. It's red at the top. And there's a bulb that's attached to what's called the alar fold. So it's a really big part that goes really deep in there. It's nearly impossible to get that part out with any other technology, with having the ability to see what you're doing without the blood in your way. Right. So that's really a big part of the problem is in the nose and actually what's living inside the nose. So it's called the alar fold that's attached to a little bulb in the back that's like this pink little fleshy part, and we just pull that sucker out, and then when we shine the light up from underneath, you can see that nice open nose. It's like unreal. So and the slit in each one of these dogs' nose is just so tiny, and just to imagine having to breathe through a slit, it's just not right.
Yeah. And if you think about it, it's wonderful that you had the laser technology, because there's no other way you could actually repair that area. There's no, I mean, what were they doing anything prior to laser procedures to correct that? I mean, were they trying to open it up, or what were they doing?
Yeah, so they're putting so many different products to try to get the bleeding to stop.
Yeah.
In that nose, and so much bleeding.
Oh,
And we'll do these, these laser meetings every year. There's something called the American Laser Surgery Club. And there's the Veterinary Laser Surgery Symposium that we do every year, but we'll compare, okay, this is what it used to look like. And you have a dog with like just blood gushing out everywhere with a scalpel blade. And there's a difference between laser and cautery. People often get this confused. Oh, so you're just cauterizing? No, we're not cauterizing. Cautery is like 500, 600, 700 degrees Celsius. Laser is 100 degrees Celsius. So the thermal damage of these other devices is so much worse because it's so much hotter, right? You could fry anything, but do you really want to fry a part that's helping or risk, creating that problem in those other areas? Right. So I had the pleasure of meeting with the inventor of the carbon dioxide laser. His name is Dr. Kumar Patel. I was able to meet with him this year, and I was honored to receive the Laser Surgery Award this year for helping to spread, the knowledge on this BOAS and how we can correct it with the laser. So when he invented, he's a genius, the CO2 laser. He had no idea how many medical applications it would, fruit and what people are going to do with it. And it just, it continues to change and to have, new ways of helping people and pets. So they're using it in people, in babies with tongue tie, dentistry applications, all kinds of ways to help. And, it's just one of those things that cannot be replaced with these other, tools that are being compared to it.
Yeah, that's amazing. Because, alternative, I would imagine if you did use a scalpel, and because it's so much, the blood supply in the area is so rich, imagine the potential aspiration. I mean, all the things that can go wrong with it. So this is great.
Yeah, the blood goes from the nose down to the throat, and then they can swallow it. Or you don't want a lot of blood in your airway, because that's not a good problem to have.
Yeah. Wow. No, this is very interesting. Well, gosh, I think, look, I touched on some of the air travel things, and I don't want to beat that further. I think folks understand, because you really explained a whole lot more than in more detail that I even thought about, to be honest with you, because I was considering it more the repercussions of seeing heat stroke leading to heat, to death. I never thought about the respiratory issues and aspiration and all the different things that can happen that way. So I'm so happy you're here to share that information with us. And I'm hoping everyone found value out of this, because this is definitely amazing. Is there anything further you want to share with us? Anything upcoming? What else you have going on in your schedule this year? Tell me about any presentations you have coming up to help fellow veterinarians.
So essentially, I would urge, pet parents who are interested in learning about helping their dogs breathe. They have a short-nosed dog, to do some research. There are websites like mine, BocaMidtownVet.com, where I have a page that's dedicated to BOAS, education-wise and before and after. So pet parents can see, the differences with these dogs. But also, Vet Scalpel is the manufacturer of this laser. It is made here in the USA. And Vet Scalpel not only helps to connect veterinarians to the technology, but also the pet parents, because you can go and ask to, search for a veterinarian in your area who has a laser, and maybe be able to connect with someone who you didn't know, could provide this minimally invasive BOAS laser surgery for you. And we do see pet parents, from all different places. We do virtual consultations. So, our goal is really to help as many of these dogs the sooner the later, because we know what happens with time. And, do your education on this problem, look it up, research it, make sure, you know what's normal and what's not normal. As far as what's new for me, I just kind of continue to connect with as many people like you, because this is how we make something change. This is how, we go into that, that real shift, and, just raise awareness. And that's the paradigm shift that happens with these types of situations. we look for a better solution, we discover the solution, but it's not just enough to discover, oh yeah, I could do this. We need to show people that it's okay for these dogs and safe for these dogs to have this done, that it's better when it's done earlier than later. It's better when they have less symptoms than more symptoms. Just like anything in life, you find something, like we talked about in the beginning, you're proactive rather than reactive when they're at the ER, and now they're all, secondary changes. So,
Right.
It's just part of, I think, what we do now, thankfully, like podcasts like yours that help us to share this information and, educate everyone, whether you're a vet or a pet lover or a breeder, anyone who has the animal welfare as a priority needs to know about this.
Definite. Well, I'm glad to have you here to definitely educate me and others here, because I didn't realize the extent with them. As far as I knew about it, but I just didn't know the extent of it. So I really appreciate you being here and sharing that information with us. Please, I put Dr. Boaz's information up. Please contact him. And if you have a brachycephalic or short-faced dog and he's having issues, don't wait. As we're saying, let's be proactive instead of reactive as far as taking care of our pets. Also, be mindful again with fear, anxiety, and stress. Any stressful event with these breeds, air travel, going to a new place or wherever it is, can lead to a bad consequence with them. I say during air travel is really, really bad, because unfortunately you can't run to a local veterinarian. There's usually not a veterinarian available on an aircraft to assist you, at least medically, in that standpoint. So you are at risk going by air travel with a dog that has severe signs of BOAS. So again, before you travel, please speak with your veterinarian, find their rating, the B rating for them, to ensure that they're hopefully safe for travel. If they're not, please find yourself a veterinarian like Dr. Boaz and get some care for your dog in general, just to keep it safe and promote safety and animal welfare with your pet. So that is all I have. Again, Dr. Boaz, thank you so much for joining us. Everyone, please, again, join us again next week. I'll have another guest on us for the Veterinary Air Travel Podcast. So thank you for joining. Bye-bye.
Thank you.
Don't go.